Hi, everybody. This is State Representative Joe Sosnowski, representing both Winnebago and Boone County. This is, I think, maybe our fourth in a series of a handful of different interviews that we've done with folks in the medical profession locally. And today, joined with us is Dr. Tim Durkee, who both works in the medical field, and he also doubles as an alderman within the city of Rockford. Tim, would you like to introduce yourself to everybody?
Sure. Yeah, my name is Tim Durkee. I am the heir to Joe Sosnowski's aldermanic seat in the city of Rockford. I'm doing a much better job than he did. So.
Much better job. That's what I hear.
But I'm also a OBGYN, I'm a physician at Swedish American Health System, and I'm also chairman of Department of Obstetrics and Gynecology at the College of Medicine here in Rockford. We have a regional College of Medicine, and I chair a small department there.
Great. And, I'll preface this too. Some people have asked, what profession do doctors specialize in? And, we've been lucky to have a variety of different practitioners from either emergency room or general practice or family practice, and then yourself. Give their perspective. But obviously, being in the medical field, you're working with a lot of doctors all the time. Of course, you have a specialty area, as most doctors do, but I think your perspective is very important to have, and then especially as a policymaker too. I think you have kind of a unique advantage. We don't have a lot of doctors that are in elected office, but your ability to have that perspective from the well-being of Rockford and as both a city and an economic engine, I think is important. So thanks for your time today. We'll go through a couple of questions and just want to get your thoughts and feedback on kind of what's happening in the world around us. As you probably no doubt have seen, Facebook, of course, we always have not necessarily the best debates, but I think both publicly and nationally, we have different policies that are emerging from different states. So in particular, I want to talk to you a little bit about face masks and what has been mandated by the governor in Illinois through an executive order. Get your thoughts on that, especially compared to, the CDC obviously gave strong recommendations at the national level. They weren't mandates. And then most states have not adopted that as a formal requirement, but here in Illinois we did. And in fact, I think there's about 85% of the states have not. So I just wanted to get your thoughts on, the effectiveness of the mandate. Should we have it? Is it important to have? And how does that play out in our day-to-day lives?
Yeah, masking, that actually is it's not a simple question with a simple answer. Interestingly, when the COVID pandemic started, masks weren't recommended by the CDC. So they've changed. But that's not because the CDC is doing anything bad. It's just that, with this COVID pandemic and how the virus has moved about and how we study it, we constantly retool and do different things to respond to, this illness. But masks, obviously they're constructed very, very differently. But the first thing that I've noticed about masking is how they're worn. So overall, the overarching thing, I guess it's not going to do any harm. I saw some things that, if you wear a mask, you can actually hurt yourself. And I scratched my head when I read that, but I have no idea what that means. But masks, the construction of them varies. The cloth masks that people are wearing all over the place, actually, there's a lot of reports that say they don't do much good. There's a theory that COVID begins or grows in the base of your lung, and in doing so, when you cough or sneeze, these deep coughs, the virus actually aerosolizes, meaning it's more of a mist. It's barely a particle, as versus droplets. Like if you sneeze, people have all sneezed, they get it, without getting gross on your video. But but when you have a deep cough and you aerosolize the virus, that aerosolized particle can actually go right through the mask. And if there's enough force behind it, it's going to travel. And there's been studies actually that show these cloth masks where people cough at petri dishes at distance, and they find that virus does, and particulate matter does travel. And so with the cloth masks, their efficacy is dubious as to whether they completely filter out everything. And like I said, with enough force, these things go right through the aerosolized particle, right through the mask. In addition, the mask, air follows a path of least. So the particles can fly out the sides or over the top of the mask. The way I see people wearing them is questionable. They're loose at the top, they're loose on the sides, and they're not really capturing everything that is emitted when somebody coughs. And remember, their effect, the big effect is cough. The big thing you want to avoid is coughing. It's unclear what happens when we are conversational within 6 feet. There's theories that you can transmit it. Some people think you can't without propelling the particle. So people go back and forth. But there's people are even study how much force is when you say the letter P, and whether or B or something, and whether that propels a particle into somebody else. So there's some odd studies that are out there, and you're right with Facebook. There's all kinds of stuff out there that you could read. The overarching principle, though, is they won't hurt. They can't hurt. The question is how much good they do. Now, if you're using a cloth mask, it may or may not offer you some protection. If you can get your hands on some of the more surgical grade masks, now they actually can stop particles to a degree. And obviously, the N95 masks they stop particles at like 0.3 microns. So these are the ones that we wear, taking care of patients, to prevent the acquisition of the virus, or even, let's say I'm an asymptomatic carrier, prevents me from transmitting it to a patient. So, but the other concept is no one recommends masks alone. There's some stuff out there that talks about 2 layers of protection, mask in 6 feet, or 2 masks, and things like that. But no one recommends a mask alone. And so the social distancing, the hand washing are important. And it brings up an interesting caveat, because most of the masks that people wear are kind of, unless they're starting to get some of these a little more exquisite, these masks are loose fitting or poorly fitting. The surgical masks that we have, for instance, sometimes have a plastic or sometimes a tape by my nose, and it actually adheres to your face. It doesn't slide. What happens when you have a mask that moves about, you land up putting your hands to your face all the time. And so you keep putting your hands to your face, that mask may be full of virus. Now you start transmitting the virus, or you pick up the virus and put it on your mask. And so that's, it is controversial. I guess, the states don't mandate them because I think most states realize that the quality of masks that people are using are of poor quality. So.
Sure. Well, I appreciate that perspective. I would assume, let me ask you this little trivia question. On a scale of 0% to 100% effective, when they wear it around their chin, between their ears like this, not covering their mouth or their nose, how effective is that?
Yeah, I don't know. It is, like I said, I go out and about, and I watch people. It's uncomfortable, where the uncomfort comes with mask wearing is the nose, especially if people wear glasses. The glasses fog. So what you constantly see is people will drop the mask over,
just cover their mouth.
Nose. Yeah, and most of us breathe through our nose, and so it's, sooner or later, I know some cool person will figure out a really great mask. We had somebody at work come with like a painter's mask.
There you go.
The 2 valves on the side.
Yeah.
I don't know. I was looking at Jacques Cousteau or what, but so people are getting clever with different things. But by and large, if you really want protection, you got to wear an N95, and they're horribly uncomfortable.
Yeah.
So.
So change subjects just a little bit, but obviously related to our environment. From your perspective, both medical and political, what's your thought on reopening? Obviously different states are at different stages. We are essentially for non-essential business shut down until the end of this month, and then for restaurants even, according to the governors, up until the end of June. What do you think in those areas? What should we be doing? What do you think is practical and reasonable?
Yeah. Yeah, I know you do too. I always bristle at that government term, essential and non-essential. I think business conducted safely or business conducted with some risk is a better term. But I would go back to, as far as opening, we go back to some guiding principles. Number one, we have to remember why we did what we did. We did what we did because we wanted to prevent an overwhelming response of getting a bunch of people sick and having them land up in hospitals requiring ventilators, ICU, healthcare workers. So both physical assets as well as people assets. So we didn't want to overwhelm the system to the extent that people would show up and they couldn't get care. I remember we all heard the possibility of us rationing ventilators in New York City. Fortunately, that never happened. But that's why we did this, to flatten the curve. It also bears reminding people you cannot uninvent a virus. The virus is here and it's not going to go away. And I would dovetail on a lot of comments that have been made, from the government and national level, is we may not ever have a vaccine. So this virus may, run through. I mean, I've drawn some parallels with polio. So this virus is going to be around. So the best thing you can do, is what everybody is saying, is be smart about it. But we're in a post-COVID world. It's almost like the pre-9/11 to the post-9/11. We're in a post-COVID world. And, most citizens, I think they're intelligent and they think they pay attention. And they get mitigating factors. They get washing their hands. They get, using the masks. If they can get a high quality mask, they get, essential, trips and things like that, and avoidance. And we're smarter about who this virus seems to target. Everybody will give an anecdotal story. So somebody will say, yeah, I knew this 25-year-old male who got COVID and he succumbed to COVID and died. And then somebody could tell the story of the 85-year-old who walked out of the hospital. So we can argue anecdote all day long and it's meaningless. Everybody will have a pointed story, but we don't create policy. We don't do healthcare based on anecdote. We base it on good, sound practice. The principles overall that, the statisticians and models have been trying to use have been, mostly wrong. They really haven't. And it's not because they've been negligent or they've been mismanaged or malevolent. It's just that it's a moving target. And it's very, very difficult to computer model something that's brand new that you don't know how is running through a community. So with that being said, in this different world for opening, I think we can. And I think we can because, number one, we're getting smarter with treating the disease. We're also getting smarter with identifying who's at risk. And I have two of the risk factors, I guess. I'm 63 and I have high blood pressure. So Wisconsin's open. Well, I'm not going to drive up to Beloit, to go have a burger at a bar, because I, as somebody with some risk factors, will want to see and take caution as to how this virus is working its way through. There's other people in low risk categories that seem to carry it. We have a lot of asymptomatic carriers. So there's a study out of Stanford, the infectious disease epidemiological group, basically has done some antibody testing and they extrapolated onto a population. And they believe that, I think his numbers are 50 to 80 times more people are carrying around COVID than we realize by simple testing alone. So this thing may be already all over the place. Coronaviruses are very easy to transmit. So I think people are aware, people are practicing best practices. I don't believe as businesses open, the first thing you want to do is throw the doors open and have everybody get sick in their bar or their restaurant. You know, at some point, at some level, the government is not the nanny. The government can offer guidance, but the government has to trust its citizenry to do good things. And the government should trust it at, you know, the centralized government, national and even state, should trust local government where it's more effective, government's more effective where it's closest to the people, to monitor things and to do things surgically rather than with a sledgehammer. So I think, for instance, in Winnebago County, I think we're already in phase 3. I think the health department's done a good job. They're doing contact tracing. Our positive rate is low. The percentage of people who are infected is low. And we're finding out in reality that the case fatality rate, which is the number of people who die per true infected people, is actually lower than anticipated. The best experiment right now that's going on is Georgia. So Georgia opened, and they actually saw a decline in cases. And so, but remember, they're not opening in a pre-COVID world. They're opening in a post-COVID world with all, you know, these protections in play, and they're seeing some pretty good results. And I think Governor DeSantis and his early response, the state of Florida has a pretty high elderly population with a lot of retirees and such, with some comorbidities, but their rates of acuity, where they were getting very, very sick, were low, because when he came out of the box, he targeted at the high risk groups. So I think overall we're in good shape to open. We don't have a lot of cases. People are smarter in a post-COVID world. The case fatality rate seems to be low. We can identify people at risk, and they can mitigate, you know, themselves. And the thing to remember is, if we open up Winnebago County or the state, that doesn't mean you're obligated to go out. You don't have to go. You don't have to go to a bar. You don't have to go to a restaurant. You don't have to go to a restaurant at all for the next year. You can stay at home and watch if you're at risk, or you can send somebody out for yourself. So long bloviating, but I think we're in good shape. I think we're in good shape medically. The other thing is we're using where I find a little bit troubling, we're using some metrics that I have a hard time understanding. For instance, this case positivity rate. I don't know how they're using it and where it comes from, which is the number of positives as a percent of those tested. And so what happens is we test a whole bunch of people, and we say we test 100 people and 14 are positive. That's a 14% positivity rate. But it depends on who we're testing. So if I am a worrisome person and I want to manipulate those numbers, let's say I want to be a little bit, I want to get policy driven my way. What I do is I overly screen people. So if you don't have a fever, if you don't have muscle aches, if you've never been exposed to somebody else, if you have all those things going on, fever, muscle aches, I've been exposed to somebody, I'm fatigued, you get tested. But if you don't have those symptoms, you don't get tested. So what will happen is, of those 100 I test, maybe 50% test positive. So now I have a 50% positivity rate. So if I'm anxious to open, like Georgia, let's say somebody wanted to skew the numbers, I can just basically call everybody healthy or not and say, go get tested. So I get 100 people who are healthy and not really screened very well tested, and I get 5% positive. So that's a 5% positivity rate just by altering how we do that. So some of the statistics, I quite frankly don't know how valid they are. What was really valid is the prevalence of the disease, who really is carrying it, the acuity of those who get the disease, and the case fatality death rate. Those are meaningful numbers and statistics that we could utilize to apply to a population. So overall, I think Winnebago County is in good shape. I think we can open.
Well, let me, and you can verify my numbers if it sounds accurate. And I like sharing these statistics a little bit. I've done this on previous interviews. If we look at our case count, I think we're maybe at about 1,200 total cases that have been in Winnebago County documented, fair enough documented cases. Probably a lot of those people have recovered because this goes all the way back to the beginning of March. So like you had mentioned earlier, I think if I'm running my stats correct, that's about 0.4% of the Winnebago County population.
Right.
And so I think it's important, some of the early, you mentioned some of the early estimates were that we could have 20% of our population infected in a very negative way that needed hospitalization, up to 60%. And so when we were looking at those original numbers, those are big numbers, but looking at what is less than 1% after, how many months now, some people think this could have been spreading around as early as December. Those are very low numbers. So back to your point, it sounds like in your estimation anyways, if hospital is low and we've got plenty of resources, and in your perspective from, working in the field and your fellow medical practitioners, you're not seeing huge demands on our hospital system at all right now?
No, we have the city of Rockford has some pretty talented people that are running a command center within the city of Rockford. So, and when I say the city of Rockford, it's really the county of Winnebago and parts of Boone, because the city of Rockford, the three medical centers, service this northern Illinois area. So they're actually servicing a region greater than the 285,000 people that live in Winnebago County. So our command, I forgot the number at Swedes, if it was 47-ish people who had COVID in the hospital. This was at a point in time. OSF had none, and Rockford Health System had 6. So as far as our resources, we're in pretty good shape. Now you never want to test it,
right?
You don't want to do anything untoward to test those resources and basically say, yeah, there's nobody in the hospital, so let's go do this. And that's why I keep drawing making the point that it's a post-COVID world. So I don't think if we open things up, people are not going to respond like they did, last November. So people are going to be acting differently. Plus, I'm sitting here at my office. You and I live in the same neighborhood, and you probably have noticed this. The statistics that have come out have basically said that these comorbidities are almost lifestyle generated. Obesity is a big factor in having a higher rate of acuity when you have COVID. Obesity, hypertension, and diabetes. Type 2 diabetes. Type 1 diabetes is not a lifestyle disease. Type 2 diabetes is. So if you take 3 morbidities, type 2 diabetes, obesity, and hypertension, those are lifestyle diseases. And so as I said, what I've noticed is you have too, there's a whole bunch of people walking in the neighborhood. People are out and they're the same neighbors. These aren't new people that have moved in, but the ages of them are in their 50s. Sure. We have some young folks, but I think people are out and about, and in this post-COVID world, I think most people are pretty, you always have people who are challenged, but most people are pretty smart about things. And I trust the citizenry. And I think they're paying attention, and I think they're taking care of themselves, all of which would possibly lower the acuity of disease should they get it. I mean, if you go into Walgreens, where I go get my blood pressure medicine, the shelves are all the vitamins, all the supplements a lot of them are gone. So not that the supplements will help or not. It's just that people are very much aware. They're now very cognizant of their health. And so when you start having people making these good choices, it's a good thing. Now, hopefully there's no extinction to that, and that people continue to take care of themselves. And this, if there's a silver lining with COVID, it would be that people would take their health seriously. They'll take vaccination seriously. They'll take preventative medicine seriously. And, hopefully, like I said, as this virus continues to sort of reverberate through, the globe, it doesn't have the impact that it did with the first time around.
All right. Well, Dr. Durkee, we wanted to be sympathetic to your time. You're very busy, but thank you so much. I didn't have a lot of follow-up questions because you ticked right through them in your explanation, but we really appreciate that perspective. Thanks for all the work that you do, both in the medical field and as a city council member. I know that can be a tough lifestyle, but I do appreciate your filling in for my role when I went to the state legislature. So thanks for all that you do. And I know Rockford is well represented by having you there. So thank you very much.
And likewise, I think, we appreciate, the job you're doing in Springfield and the consistency and the principles that you adhere to. So kudos to
thank you so much. So I appreciate everybody joining us. Again, my name's State Representative Joe Sosnowski, and we had Dr. Durkee here. If you have any questions for us, or if you'd like to forward a question onto the doctor, we can certainly do that on your behalf. So just go ahead and contact our office, send us a Facebook message, or email us. So thanks again for joining us. Take care and have a great weekend.